This is Duke University.
Working with global health innovators, they face a lot of challenges when scaling. The regulatory approval, the culture, thinking about the end user, just the introduction strategies, the market. These markets are kind of low profit. Reaching out to rural populations, it's kind of an unsexy job, and there's just a lot of challenges in scaling that we've seen with our groups. They will come to us, and I think typically many of our innovators will have immense skills in either the technicalities of their work, or perhaps they'll have an interesting business model, but the technical aspects might not be that well along. And so we recognize that they need kind of mentorship and support when scaling. And so we've been excited, through the HESN, the Higher Education Solutions Network, to partner with Duke in the SEED program. And I think that the learnings on scaling the challenges innovators are facing at stages further along than perhaps the Saving Lives at Birth innovators, recognizing what those challenges are, I think we can probably help mitigate them or hope to mitigate them earlier on. I'm very excited about the tools that will come out of the SEED program. I think that those will live long and be applicable to innovators outside of the program, and so that you will have impact kind of beyond just the cohort of 25 at the moment. And I think that we will be able to use that at USAID for other innovators that we're funding further down the road, and I think that will the tools and the research, I think, will be an immense help. I think the element about social entrepreneurship that is important to what we do is that social entrepreneurs come with, I think, the business-minded approaches. The idea of kind of that long-term planning, really thinking about the implementation and the execution. Not that public health specialists don't, but sustainability and kind of scalability is the game. And we want to put ourselves out of business eventually, and USAID does. And you want these solutions to carry on and have impact. And I think that's what I think social entrepreneurs can bring, those skill sets. I would encourage students to go out into the field, get experience, see the problems firsthand, talk with people. Find out what daily life is like. Go and price things out. Walk through someone's shoes. If you were to have a medical problem, go to a clinic. See how long you have to wait. See what advice you would get. Go to the pharmacy. How much are you going to pay? What is that like? Is the drug there? Really just walk through things from end to end and see what that's like. And then from there, I think ideas and formulations and solutions can develop. I did the Peace Corps about 1.5 times, and I think that really laid the foundation for seeing the needs, and you become just passionate about wanting to kind of make things equal for everybody. And I remember I was on a bus. I had just gotten on at the kind of local health clinic, and this woman and her mother-in-law get on next to me, and she's sitting next to me, and the bus ride is probably only about 15 minutes or so, and she was sharing with me how she saw the doctor because she was having cramps, and the doctor didn't know really what was going on and just advised her to go home. During that 15-minute bus ride, she had a miscarriage next to me, and all I had was, it was fairly early on, so there was a lot of blood, and all I had was a water bottle to give her. And we got off at the stop, and she cleaned up, and it was just powerful, and I think that image just sticks with me, of why did she have to go through that, and then she has to walk home to her village. Why, it's not, everyone should have access to good care and equal care.